Welcome to the Bone and Joint Playbook with Dr. John Urse, where we explore an extensive range of orthopedic topics and insights. Our goal is to help you understand the available orthopedic options and treatments available, and hopefully give you some answers to questions you might have. We want to thank our following sponsors.
Ted's Authentic Greek Salad Dressing and Marinade. It's healthy, gluten-free, and delicious. You can find Ted's in Dayton, Ohio at Dorothy Lane Markets, Health Foods Unlimited, and Dots Markets. That's Ted's Authentic Greek Dressing and Marinade. Thanks, Ted.
We would also like to thank
Stifel's GWR Group combines more than 65 years of experience helping high net worth clients consolidate, coordinate, and simplify their wealth planning strategies. The group has access to a full suite of resources to serve all of your financial needs. Email gwrgroup@stifel.com or call 937-353-2863 to speak to Guy, Brad, or Jeff Richardson. Stifel, Nicholas & Company, Incorporated.
Dr. Urse, we're back.
Hi, Terry.
Welcome. It's always good to see you.
Good to see you. We have a guest today.
We do. So before we get into our guest, we want to tell you folks out there, we're going to be breaking this podcast into two segments. Today we're talking about...
Is PRP for me?
It's PRP for me. And the reason we have a special guest, this is my son-in-law, Bobby. And Bobby's had knee problems for many years. I remember ever since I've known you, it seems like you've had knee problems.
Yep. Since I was in high school, 16, 17 was probably the first doctor's office I was in to talk about what ended up being a lifelong knee issue.
So we're here to talk about a very common issue with knee problem and maybe some possible solutions that Bobby could take advantage of down the road. So first we want to get into a little bit of history about Bobby. Bobby, what age did you injure your knee and how did you do it?
So I was a sophomore in high school the first time I had a knee injury. So 16, now I'm 35.
And how'd you do it?
It was just in a football practice and just a collision. I think it was a helmet on a knee was the initial something's wrong, swelled up. And I think initially it was just diagnosed as a meniscus tear.
And who did you go to your family doctor or did you go to orthopedic guy?
It was initially a family doctor and then referred to, I think, the team doctor at that point.
Does that sound familiar to you?
The way things usually roll.
Yeah. And then when did you notice that maybe this wasn't healing correctly?
The next time I injured it, and it's been a journey of whether or not it was a chronic, ongoing genetic thing, or it was maybe came back to the sport too early. So it was a cycle of injury, rehab, cleared to play shortly after playing. That next season, injure it in a similar or sometimes different way.
Yeah. Back
into a doctor's office, surgery sometimes, more rehab.
You did surgery?
Re-injure it. That time was just, the very first time was just scopes, just meniscus scopes.
And what do they do when they do a meniscus scope?
Well, remember, your meniscus is a little sponge between the two bones. So the knee joint has a thigh bone and a shin bone. And the meniscus is a cushion. There's an inside one and an outside one. Think of your little toe and big toe side. And when you lose some of the cushion because it's torn, like a tear in your sponge on your kitchen counter, then when that gets trimmed away, because it's what's hurting your knee, you lose the cushioning effect, much like a brake shoe pad in a car. So the brakes start to squeak and grind because there's not as much padding between the brake mechanisms. So knees then lose that ability to cushion the cartilage, which is the white stuff you see at the end of a chicken bone, called the cartilage. And that usually keeps our joints gliding. Without the cushion, or the meniscus, or part of it, then arthritis occurs quicker, or wear and tear in the knee occurs quicker.
And that's what the scope is called.
A scope is a way to look in a joint with a light.
Yeah.
But then they can see the cartilage, they can see the meniscus. What I think happened, it sounds like he would have had the meniscus trimmed, but over time, without the padding, you've lost some of that cushioning effect, and that's why, some of our podcasts will focus someday on meniscus repairs and trying to fix the meniscus so you have that cushion whenever possible, so the knee doesn't get wear and tear at a younger age than we'd like. And here's a perfect example. Somebody with a, we always give people the idea that our job is to get you to age 90 with your body parts. He's not even at the halfway mark. So, what are we going to do? And what I'm going to do is talk a little bit about how I would approach a patient like this. And he's, full disclosure, one of my patients. But we would then have a discussion of what are his options to do things for his knee that are going to optimize his daily activities, but also keep him in the game to do things and to get down the road with his knee that he's going to have to live with the rest of his life.
So before we get to what his possible new options could be, let's talk a little bit more about, do you have family history of any kind of arthritic knee issues?
I do. So at least my dad directly had bad knees. I remember him talking about having bad knees in college, and then he had big old swollen dinosaur knees all his adult life. But
is it hereditary?
Nope.
Oh, okay.
I was going to let you guys keep going, but unless it's something like rheumatoid arthritis or some of the what are called immune diseases, wear and tear arthritis sounds like the common theme is football here, or traumatic injuries to a joint. So we talked about things in one of our podcasts on arthritis where trauma or injury to a joint, much like a helmet hitting the knee, things that would cause inflammation in the lining, like rheumatoid arthritis or gout. But then other types of things are sometimes wear and tear or results of recurring surgeries where you've lost the cushioning, the meniscus is gone, now you've got less padding, and the joint starts to wear down some. Some of it's affected by our weight, our activities, and certainly genetics probably has some. I mean, your body habitus maybe has an effect. If your parents are really large people and you're large, you're putting more force across your knee in that way indirectly. But as far as osteoarthritis, there's very few genetic markers I'm aware of that would say, Grandma had a bad hip, I'll probably have a bad hip someday. Probably not. Unless you have something that traumatizes it, or you're born with a shallow hip socket, or some square-shaped ball instead of a round ball. It's a mismatch.
So if Bobby had his injury 16 plus years ago, would you had him do anything differently?
Well, it'd be hard to tell without knowing what the scope pictures look like.
Right.
And not all meniscus tears are repairable. So there's the meniscus, again, is like a sponge on your counter, except it's a C shape instead of a rectangle. And if your tear is on the part of the meniscus that doesn't have blood flow to it, you can't stitch it and have it heal anyway. So certainly some parts of the meniscus are not repairable, and some of them on the edges, which are more able to heal because they have blood flow, those can be repaired. So there are suture techniques, and you would want to try to fix it if you could, but that would be based on what the tear pattern looked like, what his MR images look like. Maybe he had some cartilage damage starting on the in his arthroscopies that he had at a younger age, and maybe that was also injured when the meniscus was injured. So without knowing more,
but did they make it sound like, Bobby? Did they make it sound like to you that this was a serious thing, or just like ice it up and go back in?
Yeah. So I remember my parents talking about this because they debated whether or not even telling me. After my first scope, post-surgery, it was, as a parent, I'm sure it's everything all right, good. And in that kind of post-stop, coming out of recovery, they told my parents that there were signs of very early arthritis. And I'm, as a 16-year-old, 17-year-old.
Why would he have arthritis at that age?
Because you've directly traumatized the cartilage.
But this is when you first went in there, right?
Yeah, if you have a helmet hit your knee, you can do that, or there are other types of things where the blood flow to the cartilage gets interrupted. There's a thing called OCD that isn't a compulsive disorder, but it's a blood flow disorder to the knee, and it can happen in other joints where part of the cartilage doesn't get nutrition or blood flow.
How fast does arthritis happen?
Well, arthritis can happen from various things. In that case, it sounds like he had a little bit of wear and tear. We grade cartilage wear by how it looks on a scope. We can see it also on images like MRIs. And if it looks normal but is soft, that would be a grade 1 cartilage softening or very, very early arthritis. When it starts to have fraying, like kind of moss on a tree branch, that is a little greater stage, like a grade or a stage 2 arthritis or softening of the cartilage. And then when you have cracks, like fissures in an iceberg, those are more serious wear patterns. And then at the end stage of cartilage wear is no cartilage. You have bone on bone where there's nothing there to cushion the joint. So cartilage is graded on an appearance most easily with a scope because you're looking right at it.
Yeah.
Before 1980, we opened your knee up and looked right at it, which, still was accomplishing the problem, but it was a little longer recovery time.
So we Bobby, just so we get it on camera, you're okay with us showing your X-ray behind us, right?
Yep.
So, okay. So would you be able to tell by this X-ray that his cartilage is going, or is that done through another procedure?
No, you have indirect evidence because his X-ray shows some areas of what's called joint space narrowing.
Can you hold this up kind of and just point to that? It'll
Sure.
be behind him. But
Sure. So in a knee, I'll take a pane. You can see a space here.
Hold it up so
Up high. So the space on the inside of the knee, and this little bone on the outside is always the outside of the knee. So whether it's a right or left, this is a picture of a left knee. This is the outside of the knee, called the little toe side, right? Called lateral. And that joint looks narrower than that space. Just look at the amount of space, the clear space between the bones is taken up by cartilage and some of the meniscus. If that space is narrowed, the cartilage is wearing down or part of the meniscus has been trimmed. And again, you have a little bit of you get little things called spurs, which are little signs on an X-ray of arthritis. There's a little bit under the kneecap, which is a different area of the knee in the front of the knee. But his main thing is he does have, signs of, I'd say moderate arthritis in a knee for a guy in his 30s. So that's what I would do then is go over some options for him in the office after I examine his knee to say what things can we do to optimize your treatment and get this knee feeling better.
So, Bobby, the thing I forgot to ask you at the very beginning, and I apologize, was describe the pain.
So it's not consistent over the course of a year or even a course of the last 5 years. It's the biggest issue right now since I've really stopped being as active after having kids and just having less free time for hobbies and whatnot. It's when it's the worst, it's because of the swelling, and the swelling comes and goes.
Why would swelling happen?
You've lost the cushioning again, so the more contact and the more impact the knee has, the more the lining gets inflamed. That makes the joint swell. So think of sparks on your car when there's no brake shoe pads and you stop and it squeaks and grinds and then the car stops, right?
So that causes swelling. The inflammation causes swelling.
You're losing the cushion between the bones. Arthritis hurts and causes swelling when it loses the space between the joint and the cartilage isn't there to cushion the joint as it moves. Elbows, knees, shoulders, hips, whatever joint it is, the cartilage is the lubricant that covers the end of the bone to keep bone from rubbing on bone.
Bobby, is there anything that you do that you notice, oh shit, that hurt, I know I'm going to suffer now?
Yeah, I mean, it can be as slight as the one time it happened as I was fixing our dishwasher and I was just getting up and I didn't get up. I got up in kind of an awkward way and I felt it kind of something loose or just the way I pushed up on it. I could feel it wasn't quite right. And I knew that next morning, I was going to wake up in pain and swelling. And sure enough, so it can be something as small as that. If I am doing something active, that is certainly just rolling the dice on whether or not I'm going to get hurt if I'm doing anything athletic. But at this point, it can happen as just me turning the corner.
And if how they hold that little chart up in the hospital, it has a smiley face and a sad face.
Yeah.
1 to 10. What is your pain level when it inflames and gets bad?
Yeah, when it inflames, it's a 1 or 2 if I'm totally resting, like if I'm sitting on the couch not doing anything, but even just walking or certainly going up steps, it's a 6 out of 10. It's livable. It's not unbearable, but it's certainly uncomfortable, and it's not something I want to always be dealing with.
And this is part 1 of part 2 of this podcast, because we're going to get into some future things that you might recommend he try. What are the things that the other doctors have had you do to kind of help you with this pain?
Yeah, so you kind of thinking back when you asked me about when it was first something more serious, my parents were getting second and third opinions, and one of the doctors I remember recommended, as I'm in the middle of what I thought was my high school sports career, just said I would stop playing sports altogether. I would stop running. If you want to prolong your knees, I would stop playing competitive sports.
Was that a good suggestion?
Probably, because you've got again, you can almost compare it to a crack in a tooth. You've got an injury to an area. Is chewing harder better for it? Is running on a knee that hurts better for it? Impact, he's getting out of a crouch position, fixing his dishwasher and having pain. So running on a football field or up and down a basketball court or running out in his neighborhood on hard pavement, it's not smart for a knee that has some swelling or some issues. So I tell people motion's good. A Stairmaster, a Gazelle, swimming, biking, all those are fine, but they're not high impact. Walking's okay, but impact and sports are not going to help it. You wouldn't say chew harder things with a crack in your tooth, right? You would say let's back off the force a little bit.
So what did the other doctors tell you to do?
So I didn't stay at that doctor. I thought that was a gut punch as a high school.
Because you wanted to keep playing.
Yeah, I wanted to keep playing. And so...
And nobody wants to hear stop doing it, right?
Sure.
So they are going to give you some options to keep going.
Yeah, so one of the paths forward that I did for an entire basketball season was I would go to that doctor's office shortly before whatever that next game was, and he would just drain the swelling out of my knee.
Can you do that? I didn't know you could do that.
Multiple times that season.
What they would have known if they had known about what's called biologics is you could take that blood or fluid out of the joint, spin it in a centrifuge. We're going to talk about layering blood, which is what this PRP. Remember, you said we're talking about PRP today. You didn't even tell people what PRP is.
Well, we're going to get there.
Well, can I say platelet-rich plasma? Then we'll talk about it later. But you actually could drain the knee, take that to a centrifuge, which is a spinning device to separate parts of layers of blood.
Right.
And then get the growth, what are called growth and anti-inflammatory factors, and actually put that back in his knee. That's what I would have done, because that would have actually helped him with decreasing swelling and pain.
But 16 years ago, they didn't do that.
Nobody did that. In fact, overseas, they were doing this around the world. Some places, most of the platelet therapy is probably in the last 10 to 15 years in the United States. But all the sports teams do it. All the musicians do it who come and want to keep playing and doing things. So this is a part of medicine that's an evolving, cutting edge technology that we're going to talk a little bit about later. But it has some great options because it uses the patient's own blood, so it's completely safe.
Right.
That's why it's called a biologic treatment.
Not to go off too much of a rabbit hole, but is that what Lance Armstrong was doing? Is that...
No. Lance Armstrong
different?
was actually doing a thing called blood doping, where he was increasing his red blood cells in the blood. Red cells carry oxygen. So when you're pedaling up the Tour de France hills in a funny shirt like yours, then you would want to have increased oxygen capacity, and that calls under different types of legal issues in the cycling world. So this is not the same thing. He's trying to increase the amount of red blood cells that carry oxygen in the blood. That's called blood doping, but it may not be illegal. I'm not the legal expert, but I can tell you red cells are not good for knees, or we'll talk a little bit about tendonitis, inflammation of tendons. So we don't want those in what we give you back into your body. So we talk about layering. We want to take away certain cells that don't help knees. In fact, red cells actually cause damage to the cartilage and the lining cells of joints. So they're not good, and that's why the spinner device, the centrifuge, separates the part of the blood you don't want and lets you concentrate the part you do want.
All right, so again, as we end this very first part of this podcast, they drained your knee. It sounds like it was a lot of fun. What else have they told you to do, or have you tried?
The main consistent remedy or just thing to do that has been consistent across anyone I've ever talked about my knees is keeping the muscles around it as strong as possible. And that is definitely a correlation I have noticed when I have one of these instances where it flares up, it's usually because I've gotten off my exercise regimen, or I know I haven't been doing my lower body workouts as consistently as possible.
We talked about that. We had a podcast called Rapid Fire, True or False, right? And you asked me about therapy, and I said strong recommendation, 8 out of 10 for helping knee problems. In fact, our Orthopedic Academy looks at osteoarthritis or conditions in knees and says, well, what about this, this, and this? Strong recommendation for therapy. Okay, it helps everybody, and everybody with any problem with their knee should go once or twice at least to get an idea of what to do at home. If you want to do it yourself, that's great. Certainly under supervision, we all work a little better with trainers and therapists sometimes.
So, last question I have for you is, does this happen or does it flare up in the wintertime more than it does in the summer?
Yes. So absolutely. The last 2 times where I had no contact injury, I can't trace it back to, I slipped up. The last 2 times where it's been the worst have both been when the weather has dropped significantly here in Ohio.
And there's a reason people are moving to Arizona. If you're older and you have joints that ache, there's absolutely a correlation between, rainy days and barometric pressure, and certainly warm and cold. And, most people will tell you warmer environments are better on your joints. And there's a reason folks go to those places for better or for worse, but certainly their joints feel better in warm weather.
All right. So thank you for joining us on this very first part of this podcast. Thank you, Bobby, for being here with us. The very next episode will be Bobby Part 2, where we talk about maybe some things he might want to consider when it comes to some newer things that are out there that you kind of have been using and having great success with. So that's PRP and stem cell, correct?
It's going to be a discussion of those and other modalities that help him get to age 90, right? We need to get him to age 90 with his body parts, and he's not at the halfway mark yet. So we need to give him those options. I think a good healthcare provider does a few things. One, it tells the patient what's wrong. Like, if you can't figure out what's wrong, you can't Google the answer or look it up on AI, right? Number 2, they tell you what your choices are for treatment. Like, you've got this, then therefore we can cure it with a new knee someday, which may be ultimately in a bad knee situation the fix, much like a car. We talked a little bit about cars on the rotors and the brake shoe pads, but think about cars that run for a long time. The cars in Cuba are still running now, 70 years later, and your knee, you want to run your car or your knee or your hip as long as you can. Someday you might need a new one. So our job is to find out what he's telling you. And I think one thing he said was pretty insightful earlier is, I said he's got some moderate arthritis, and he goes, I'm a 1 or 2 most of the time. Now, why is that? Well, we don't always know. Number 1, he's not overweight. That's good. 2, he does exercise. 3, he's avoided things that beat the crap out of his knee. And 4, the x-rays don't always correlate with the clinical picture. If he couldn't walk, if he couldn't sleep, he couldn't get out of a car, the treatment pattern changes a little bit because now you have more of a misery factor, and it's debilitating. And we talked about, hip replacements in people in their 20s, 30s, and 40s who have severely damaged hips from whatever reason. But a hip replacement solves the problem. It's a home run, but it's a trigger you don't want to pull.
So don't spoil part 2, right?
Well, that's why you got to have him come. You got to give him something to come back for.
So we'll be right back with part 2. Thanks for joining us.